This is
Metro Radio.
This is Upfront.
This is Real Life.
This is Night Owls
With Alan Robson.
on Metro.
Now, you will remember we've had this gentleman in with us before. If you have any questions about cosmetic surgery, this is the guy. The go-to guy, Dr. Dutta from Aesthetic Beauty. Hello, welcome back to you.
Hello, Alan. Thank you for the invite. I'm really grateful.
No, it's good. Now, the reason we've asked you to come back is because there's been a whole batch of changes to cosmetic surgery about what you can do, what you can't do, and who can do what. Now, a lot of this was caused by people coming over to Britain saying, we'll do anything you want, and the prices in some cases were ridiculous. And then, of course, you've got a problem, and with these people disappeared too, they're not around anymore. So what's the situation? I mean, how has the law changed?
Well, the law hasn't changed as such, but what the regulators are trying to do is to create a joint council for the non-surgical part of the cosmetic surgery.
Right.
For the cosmetic surgery bit, where it's a knife involved,
Right.
The General Medical Council is trying to get credentialing done. Credentialing means each and every doctor who will be performing cosmetic surgery at present do not have to be on any specialist register.
Oh, right.
You can technically be a doctor, train in something, and perform it. Now, to some extent, that is acceptable, but at the same time, there is an element of patient protection. You need to get the public confidence in the specialty. And, of course, we need to also make sure that the patients are not being left behind. What I mean by that, if a doctor from Europe or abroad comes in, performs a procedure, he's allowed to do it, so performs a procedure, and then he flies back home, then there is no follow-up care, no aftercare. Patients, if they have any complications, they don't know where to go. And they always, up till 3-4 years ago, ended up on the NHS.
Sure.
As you probably have heard today, NHS resources are really they're struggling. So it's unfair to put even the smallest amount of extra work.
We've had people ringing us saying, we found out that I wanted a breast enlargement or I wanted a breast reduction. I've travelled across to Poland. Poland seems to be one of the places where a lot of people go. They go to Poland, get the job done, come back to Britain and then say, well, I've got a whole host of different issues. I've been to my doctor. My doctor will do something about them, but they're not very happy about it because you're kind of picking up the pieces of somebody else's job.
Well, Poland is part of Europe, so there is some element of control there. But when a patient, say, goes to India or Egypt or somewhere abroad, comes back home, the doctor, the GP particularly, doesn't know anything about what happened.
Right.
It is cheap surgery, there's no doubt about it. And may I also add that some of the centers abroad are pretty good. But there is no way we can sit here and judge whether they're good, bad, doing the right thing, ethical things. And when these patients are coming back, as you probably would know, that 5 to 7% of patients in cosmetic surgery have minor or major some problems, and they need follow-up. And when these patients are coming back, there is no such regular follow-up, there is no such aftercare.
So it just seems there is a psychological cost then, because presumably people that get this kind of surgery done, they have a need. Now, in some cases, I'm sure you might say, well, they think they have a need, when in fact they look perfectly well, and you personally don't think they need their lips enhanced or whatever, but they're determined, I will have a different nose, or I will have this tweaked and this lifted and this put this there and there and what have you. I mean, I know for a fact, having spent a little bit of time with you previously, that if somebody comes to you and you think, you look great, I wouldn't change that. You have actually refused to do jobs. And I think, is that the difference? Because presumably they'll just take their money and run.
Well, at present, I think we have no such requirement of performing a psychological assessment on a patient before surgery. The rules that are being drafted by the General Medical Council, it's not rules, it's sort of good practice, shall we say, is taking that into account, that you must take into account whether this patient is fit for surgery, whether you're going to benefit this patient by doing the surgery or not.
Right.
And in some occasions,